Howdy, folks. It's been a while since I've been able to do an episode, mostly because I'm lazy and I'm a little scatterbrained, and I don't get around to doing these episodes as often as I would like to. Um, that being said, this is From the Pit, a heavy medical consult. I like to do these every once in a while to kind of discuss things in medicine that a lot of people don't realize, don't know about, um, may not be quite obvious, even with some run of the mill stuff. And today I wanted to talk about something called medical tourism, and specifically as it pertains to cosmetic surgery. Um, the reason why I want to talk about this was essentially because I had a patient uh, within the past month that fell under this topic. I first came across it uh, probably back in 2020, 2022, um, when I was working in an urgent care. And in this one particular site, we were seeing a lot of young people coming in to get medically cleared for surgery in Florida or outside the country. And that's what medical tourism is. You go, you fly off, you go to another state, you go to another country to have medical care provided. And in this case, we're talking about, again, cosmetic surgery. And I remember just again, it was a lot of people. And I remember one in particular. This person was very young, um, was very tiny, very thin, getting medical clearance, trying to get medical clearance for a procedure that would involve partially involve liposuction, and I could not, in good conscience, clear the person for this because I felt that there was just too much of inherent risk given the patient's small stature, that there would be risk for organ perforation with the procedure. On top of the fact that there wasn't really any, fat on the person to do liposuction on. Um, I hopped back into emergency medicine um, and kind of forgot about this until recently when I had a patient come in having complications uh, after the fact, and and that's where the real issues come into play with with medical tourism and cosmetic surgery tourism. There's a lot of risks that go along with this, and this isn't a bash against cosmetic surgery, plastic surgery. There are many excellent cosmetic surgeons, plastic surgeons that do very very good work. And if that's something that you want to pursue, by all means, I don't find anything inherently wrong with it. Uh, my concerns are though just doing it in a safe manner, and unfortunately, uh, these uh, these companies that you know offer it uh, where people coming to fly into them uh, can have a lot of issues associated with them. Um, Number one, and just overall, there are just overall an increased risk of surgical complications in these situations. Um, there's Patients can come back with poor wound healing, what we call dehiscence, where the surgical wounds actually just open back up completely. They can develop what are called hematomas, which is basically big collections of blood in the tissue. Seromas, big collection of serous fluid in the tissues. These are what you call swelling and pain. And just even if there's no complication, they can have very unsatisfactory outcomes of the procedure itself. The procedure can just not look good. So I mean, that's just that's just a general thing to consider. Number two is there's a higher risk of wound infections with these medical tourism sites that do cosmetic surgery. There, a lot of these places are not accredited. They're not regulated. Uh, their uh, their infection control practices can be questionable uh, and can lead to lots of post-surgical wound infections. And then on top of it, there can be a lot of issues with um, resistant bacteria causing these wound infections. Third thing is that there is again these places can sometimes not be very well regulated. So you could have people who have subpar training in these procedures. You could have people that are just outright unqualified to do these procedures, uh, and not just surgical procedures, but the anesthesia that's involved with it. Uh, these carry these carry inherent safety and concerns. Number four, um, there can be a higher risk of mortality, a higher risk of death. In particular, some of the procedures are legitimately high risk. The Brazilian butt lift, per se, they've been associated with high rates of mortality just in general. Uh, uh, but even more so with these when people travel to other states and countries to have this done, uh, there can be improper injections of the fatty tissue, leading to fatty emboli, which can essentially mimic blood clots to the lungs, blood clots to the brain, mimic stroke symptoms, mimic blood clot symptoms to the lungs, causing chest pain and shortness of breath. Speaking of, there's an increased risk of DVTs and pulmonary embolism. DVTs being blood clots in legs, pulmonary embolism being blood clots that travel to the lung. And once it travels to the lung, if it's large enough, it can cause significant issues. It can cause even death. Um, you know, People who are at risk for in general, people who are at risk for um, developing a DVT or a PE are people who are very sedentary, and that's the post surgical people after surgery are at risk for that. Um, Another thing that causes people to be very sedentary are long plane flights. So just one of these can put you at risk for developing blood clot. Um, Here, we're putting those together, okay? Because very frequently, um, patients who are having this done, they have a very short post-op period after the procedure, and they're sent home, flying back home very shortly after the procedure. So again, you got these two things that put you at risk, and they're essentially working in concert together to increase risk for DVTs and PEs. And finally, there's an overall lack of follow-up care, and this is kind of brings me back to this patient that I saw recently, and that um, patient had procedure done uh, outside the country. Uh, they flew back 2 days after the procedure, and they were having a major complication with the surgery, and the person who did the procedure is essentially nowhere to be found. Um, they're not up here in the States. They don't have uh, privileges at any of the local hospitals near us, so they come to the ER. They tell them to go to the ER if there's a complication. And now another surgeon who is coming in basically cold to this whole scenario has to come in and basically address uh, the issues of another surgeon. Um, and I mean, it's not that that can't be done. Uh, it's done, and many fantastic surgeons up here who correct these issues. But there is inherent safety concerns when it's handled that way. Ideally, if you're having surgery and you have a post-op complication, you should be following up with the surgeon who did your procedure. Um, and that's just not possible in these ways, in these situations. So again, this isn't to poo-poo people who want to have any type of cosmetic surgery or plastic surgery, but the key is to do it safely and it, it's safe for you for the best possible outcome. And these uh, companies where that have people travel to them, um, we just see a lot of complications from it. If you want to do that, something like that, uh, do it, but do it with a surgeon local to you who has a good reputation for the type of procedure you want to have done, uh, and don't be flying off to another country or another state to have this done. It's just going to increase your risk for complications and issues. Okay, folks, that's the pretty much the end of this episode. Short but to the point. Again, to summarize, there's nothing wrong if you want to have any type of cosmetic surgery or plastic surgery. Um, just if you're thinking about doing it, or you have a friend or a family member who's thinking about doing it, do it in a way that's safest for you, and that is stay local, find someone who has a good reputation, who's done the procedure numerous times, uh, can answer your questions regarding the safety of the procedure to your satisfaction. And, you know, I would just avoid any company that's offering you a deal to fly to them. There's just risks in doing that. So, we're going to wrap it up here. Uh, Playing in the background, as I always do at the end of these, we have a little Faith No More going on with the song Malpractice, and hit that like, subscribe thing. Apparently on YouTube it does something to help me. I don't know. I'm still getting kind of used to all this stuff, learning about it, but I'm told that helps me. So if you can, hit like, hit subscribe, hit the bell to be notified if I put up another video, which hopefully I will do a little bit more frequently. And just stay out there, be safe, rock on, and be good to yourself.